the background and overview about what SMS is and where it came from, so that we can lay some of the groundwork, and then I get into specifically how SMS is being used within Army medicine. So I'll start with just a few PowerPoint slides, and then we'll move on to a live demonstration of the software. So the first thing is an organization really wants to track performance management. It used to be in the past that the Army is very good at tracking task execution, but the task execution is really what you do as a hypothesis in order to meet those performance measures. So in this case, in the slide, we see kind of what we refer to as kind of the circle of life. At 12 o'clock, you see Army leadership guidance. That might be the Sec Army, that might be the Chief of Staff of the Army. Here's what the Army is trying to achieve. So whether it's the Quadrennial Defense Review or the Army Posture Statement, it used to be that the Army would produce these documents. It took a grand amount of staff work to prepare these documents, and then year after year they were laminated and then placed on coffee tables throughout the Pentagon. The problem is those documents never have teeth. And so what they wanted to do is take that strategic management, that strategic guidance, and really see how it matches with execution. And so what we want to do is take our performance management measures. What are we trying to achieve by all these tasks that we do from day to day and month to month and quarter to quarter? And how well is it affecting our bottom line, our mission statement, right? And so at 3 o'clock, we'll see, here's we're breaking down, here's what we're trying to achieve, and here's specifically our plan to try to achieve that. We start to see red, amber, green of how we're achieving that plan. And then that will affect our next cycle, whether it's the Quadrennial Defense Review, whether it's a fiscal year, whether it's the POM cycle, et cetera, et cetera. So the tagline is, we say that SMS is where strategy meets execution. So some background about the software is it was initially built as a tool for the Sec Army in 2006. The Army built SMS, sort of purchased a COTS product because they wanted to track trends over time for the Sec Army's Title X functions, because the Secretary of the Army is responsible for how well the Army is doing at recruiting, retaining, training, equipping, etc. But those are very broad, broad outcomes that the Army has to achieve. And so the Sec Army's office would receive briefings from the Army G1 about how we're doing with recruiting, how we're doing with retention, and the next day receive a briefing from the G4 about how we're doing with logistics. And then again, the G3 would say, here's how we're doing with training. The problem is the Sec Army's office couldn't compare those very dissimilar outcomes. They wanted to have some way to see the subject matter experts within each one of those areas, recruiting, retaining, equipping, etc., but would develop, here's what we're trying to achieve, here's what success and failure is, here's what red, amber, green is, and that will allow us to compare those very dissimilar outcomes. So the Sec Army's office could then focus resources, time, money, attention on each one of those outcomes. And the Sec Army said, I'm not the only one that wants to track trends over time. And rather than have every HQDA, DRU element within the Army develop requirements for tracking trends over time and pay a contractor to develop a software, well, we're going to buy an Army enterprise-wide license for this tool. Part of the reason why they bought that tool is because it's just so simple to use. You don't have to go to a subject matter expert to really learn how to do it. Once someone gives you the access, you can kind of left click and right click and learn how to use it yourself. So it's web enabled. It sits behind. Right now it uses AKO for authentication, but everyone knows that AKO is on the way out. So I think in the future it'll use DEERS authentication. So all you need is a CAT card, and you need to be in the Army to log into SMS. So the point of the tool is so that senior leaders don't have to say, 3-star says, how are we doing on X, whether it's IDES or PCMH or any issue. And rather than receive a PowerPoint briefing month after month or quarter after quarter or even week after week, if you build the charts that you want to see and you set up the data feeds that you need, your briefings can be live in the software. So the Army does the Army campaign plan. But once a quarter, they brief it live to the assistant secretaries and the chief of staff and the Sec Army, live from the software tool. There's no PowerPoint generation because PowerPoint is almost like a fire and forget weapon. Once you build those PowerPoint slides and present them, the next time you do that briefing, the next quarter, it's not easy to just go back and see, well, how did you talk about this? What were your comments last quarter, to see if your comments were correct or accurate, your hypothesis about how you were going to trend. So that's the point, is you want to end the recreation of data for reporting and briefings. So once you build it once, and it is sort of an effort at first to decide how you want to break down and measure what it is you do. Once that's built, it's much less effort. And the SMS exists both on the NIPRNet and SIPRNet, although MedCom isn't taking advantage of the SIPRNet version of SMS to date. But everything that you see on the NIPRNet gets transferred to the SIPRNet every business day. So it's one of the only tools where you can go on the SIPRNet and you see all the unclassified and classified information. If you go to the NIPRNet, you're just going to see the unclassified information. So you decide how you want to build your dashboard, strategy map, scorecard, and you decide sort of what your green, amber, red ratings are. And by you, I mean the administrator. And we can have layers of administrators. There's several roles within SMS. There's read-only users. They're allowed to just see things in the software. There's owners and updaters that can comment on performance and in some cases update numbers. And then there's the administrator level. And so I am, Lucy Goodwin and I are the two MedCom administrators for SMS. And so it's sort of a hierarchical base permissions. And so there's administrators at each one of the major subordinate commands and regional medical commands, as well as a lot of the MTFs. Because MedCom's sort of history of using SMS is the Strategy Management Office here at OTSG wanted to find a software to automate their balanced scorecard because they were tired of building 170 PowerPoint slides once a quarter to brief a certain general. And so they went to several vendors and they decided this one tool is sort of the best value for automating the balanced scorecard. They went to the vendor and said, hey, we have this much money, we'd like to purchase this. And the vendor kind of laughed and said, the Army already has a license for this. You don't have to purchase it at all. So that's how MedCom stumbled upon use of SMS. Now we see that it's sort of organized around senior leader decision processes, but that's sort of senior leader Army. MedCom can use the tool in any way they see fit. And so we'll get into some of those. And so these are the symbols and terms you'll see in SMS. The symbols here and the terms in all caps are the terms in the software. The terms not in all caps are the terms you might be used to in the balanced scorecard. So because MedCom began using SMS for the balanced scorecard, we know that our perspectives break down into objectives, which are measured with metrics. And you decide what type of metric is it, and if it's going to be measured with red, amber, green. As long as you understand there's some sort of hierarchical breakdown from your mission statement down to the measurement level, the metric level, then you get to the point of this slide. And then that hierarchical structure we recommend is built with sort of a work breakdown structure numbering system, just to make it very simple in the future to kind of understand where your data comes from. So one of the interesting and sort of unique things that SMS does is build what's referred to as a normalized score. Think of it as an index of all the subordinate measures. So because SMS was built to be the Army's strategic management system, it's not built to track, it's built so that the Sec Army doesn't have to look at every single metric within the Army, because there's, countless numbers of metrics throughout every command and organization in the Army. What it's built to do is so that we can look at recruiting or retention or MedCom's mission statement. So MedCom would get an index score of everything that MedCom does. And so the OTSG MedCom gets to decide what's our mission statement, how are we going to break down what it is we do into cascading levels until you get to a metric level. And at the metric level, we see numbers we're familiar with: dollars, percentages, the time, the time it takes to accomplish something. And so those things are built on a red, amber, green scale, and the subject matter expert who knows what success and failure is for cost determines the thresholds between red, amber, green. And that drives our normalized scores, and the scores roll all the way up so that the Army gets a score. The Army right now has a index score of how they're performing. What we always tell senior leaders to do is focus on the trend. Are you getting better? Are you getting worse about all these things that you care about? And so we'll show a few examples in the software. But also, so these are like an example of scores, but you see that you can also weight things. So if one of the 5 tasks that you're responsible for is much more important than the other 4, then it's going to have a greater effect on the score above it. So if your score is low, even though the majority of your tasks are green, it might indicate that your most important task is not performing to standard, right? And so you get to decide how you want to weight things in SMS, and it's a very simple right click in order to build that. So the hardest part about doing this is deciding what it is, what your mission statement is and how you want to break down and measure things. One of the examples I'll show is for the integrated disability evaluation system and how they're using SMS to track trends over time for IDES. And so once you do this, you'll be able to see your scores over time about how you're performing overall. And you can always come to the Director of Strategy Management for assistance. Miss Lucy Goodwin and I are sort of the MedCom's Tier 1 administrators, but we're happy to set up cascading levels of permissions for all users. We can set it up so that, and it's not going to cost MedCom or the Army any additional money. If you want to have a dashboard that shows your house and your pets, and you track the trends of the number of tuna fish sandwiches consumed this month. You don't have to go to a contractor to help build that for you. You can start to build those things for yourself at any time for no cost. So you can go to Lucinda Goodwin or John Ritchie, that's me, at any time for SMS assistance. We create accounts, we set up permissions, etc., etc. We also have resources. Now, this is an Army tool, so you can go to the Army's website for assistance, or Lucy and I have set up a sort of a Mill Suite site with sort of PowerPoint presentations and Word documents and other helpful guides that sort of try to guide you through specific parts of if I want to update my measures. I've forgotten how to do that because I haven't done that in several months. Now, what we really want to focus on is try to set up as many passive updates as possible. So I'll show a few examples. So let's log into the software. So it's very simple. I just go to https www.sms.army.mil. And it brings you to a splash page where you have to click and log in with your CAT card. And you have to make sure that you choose the regular certificate, not your email certificate. And this is when everyone logs into SMS, this is referred to as the welcome screen. By default, when you first log into the software, you only have one bookmark. So there's 3 axes in order to maneuver around SMS. There's what you're viewing, there's how you're viewing, there's what you're viewing, and there's when you're viewing. So it's how, when, and where, so to speak. So by default, it always logs you into your bookmarks. And the default bookmark for everyone is called the welcome screen. But you can build bookmarks from elsewhere throughout the software. And so I've been using SMS since 2007. I have many bookmarks, some from the Assistant Secretary for Maritime Power and Reserve Affairs, reports that were built in 2007, 2008. But I also have other things like the Army Medicine Strategy Map. So when I click on this strategy map, it's going to bring up a time period. So that's that other axis I talked about. So by default, SMS always logs us in to the most recently completed month. It does that on purpose because we shouldn't know how January is performing yet, because January isn't quite over. But on February 1st, when I log into SMS, it will by default log me into January 2013. So the tool automatically sort of keeps up. And you can click and drag any one of your bookmarks up to the top bookmark. So if I wanted this Army Medicine Strategy Map to be the first thing that popped up when I clicked on my CAC pin, all I have to do is make sure that it's my top bookmark on that left-hand pane, and this will be what shows up when I log in. So we do that for a lot of general officers. So if we have a commander's dashboard, this is for the Surgeon General. And so I'm changing back to a quarterly view to see the data from July to September. So I've changed one of the axes. I've changed the time axis. So I see the commander's dashboard of review and analysis. And so this is what General Horoho wants to see when she first logs in. So we make sure that that is the top bookmark on her screen. So as soon as she clicks her CAC login, this is what pops up when she logs into the software. These are just bookmarks. These are things that I have sort of accumulated over time that I want to see. So here's the IDES dashboard for Madigan. So it's one of my bookmarks. I click on it and I see here's how we're trending, and looks like we don't have all the data for Madigan in the July to September time frame. But if I click on quarterly and change it to monthly, it by default wants to bring me to December, but I can either use the drop-down menu or the blue arrows to go up or down. So let's look at January. So look at January 2013, and a lot of this has data, but not all of it yet. So we don't have the profile data for January 2013 just yet. But now we can see that our chart is updated, all of our numbers have updated with data from January of 2013. Now I can switch back to December. And again, I don't have to rebuild a PowerPoint slide. All my chart updates, all my data updates, but now for December of 2012. And so these are just different screen views from throughout the software. So I can go to the Lewis IDES ratio. I can bookmark even the Army Medicine website. So that's going to take me to the Army Medicine website. We'll go back to SMS. We can look at the strategy map. I can have a folder of bookmarks. And these are like reports. Let's see, I can even go to the SMS program office. We can look at system. I can run SQL queries because SMS isn't just a display tool, it's also a database. And so you can query it just like you can a database to see over the last 4 years who's logged in the most. So, I mean, you can run all sorts of things. I can look at the audiology strategy map. So, looks like they don't have any data from December 2012, and this should be fairly familiar to a lot of MedCom folks because it's a balanced scorecard strategy map. You'll see if I click on one of these bubbles, I can then drill down into a strategy map. And you can build all sorts of things. So this is a dashboard that Warrior Transition Command built a few months ago. You see, looks like they haven't updated the data since June, but if I go a few months back and click go, I can now see the trend over time for the capacity percentage in the Southern Region Medical Command WTUs. So, the software, it's the most important axis is the very top left-hand corner. I click on My Bookmarks, and these are how I'm viewing information. I can look at dashboards, briefing books, the hierarchy view, strategy maps, action plans, which are like Gantt charts, or MS Project. But we want to stay in bookmarks, and I want to go back to that welcome screen. The reason why I always keep the welcome screen as my top bookmark is because you see when I log in there's an administrator message, and so all users will see this, but if you click anywhere on this line you can minimize that. Same thing with my tasks, and so I am listed as responsible for something in action plans. So I have one task on here. So it's assigned to me. It started on November 1st, 2012. And our budget is $5,000. We've expended $250 for $250, right? I also see metrics I own. And see my CAC card isn't listed as an owner of any metrics. But I also have metrics I update. And so I can either update my metrics manually or I can import my metrics with an Excel sheet. There's many ways to get data into the software. The Army bought an enterprise-wide license because this tool is so flexible. The Army has data in many formats and many types of databases. So best case, we work out a database feed with the host database. But if the keeper of the data is Colonel Jim Smith, and it only sits on his CPU somewhere, we can upload spreadsheets from Colonel Jim Smith. But let's say I was just responsible for two things. I click on Update My Metrics. So I'm responsible for a number of workplace injuries at Fort Hood. I put in an actual value of there was 5 workplace injuries in August of 2012. And then the system's going to refresh and let me know, oh, that's red because the green threshold is 1. If there's more than 1 injury, then everything turns red. So I might want to comment on why we perform that way. And this is where the software really becomes a management system, is you can start to comment on performance. So we can say that I slipped and fell, and that was the workplace injury at at Fort Hood in August. And so now if someone wanted to reply, it starts to turn into a blog. So anyone that has access to comment in that certain structure can say that so Lieutenant General Horoho does not approve. The following initiatives are underway in order to improve workplace safety. And so now you see it becomes kind of a blog, and it lets you know who made the comment and when. And so I'll show a few examples of how this works. So, but if all you're responsible for is updating 1 or 2 measures and commenting on them, the welcome screen is quite handy, and that's why I leave it as my top bookmark. But I also have other bookmarks, like our MedCom's contribution to the DoD performance measures. I want to see, how MedCom is performing in these, and if there's any comments associated with that, or MedCom's contribution to the Army campaign plan. And I'm still stuck in August, but if I move it to December, then we'll see how we are performing in December in those metrics that link up to the Army campaign plan. So you see that it's medical readiness category data, healthy weight data, so body mass index, a 68 whiskey measure, an IDES measure, and patient overall visit satisfaction. So one of the things we want to do is maneuver through the software. So we want to go from My Bookmarks to Dashboards. Let's take a look at a specific dashboard. So this is very key. This is the hierarchy of organizations in the software. Like I said, it's permission-based. There's roles and permissions. So there's read-only users, owners and updaters, and administrators. Those are our 3 sort of levels of roles. There's also permissions. You're only allowed to see certain things. Most MedCom users, when they click on, we all see the Army Enterprise because it's an Army Enterprise-wide tool. We all see Army organizations. This is also referred to as the shared space. So all SMS users can see the ACOMs. They can see ForceCom, AMC, TRADOC. They can see the DRUs. But if we see MedCom on here, but MedCom doesn't have any dashboards in the shared space. But if you click on User Workspace, the plus sign next to that User Workspace, those are referred to as the private workspaces. And so MedCom only has access to see 4 private workspaces. I still have the residue of working in the Army level, so I see all workspaces. So the shared space is almost the tip of the iceberg, if you will. So these are all the organizations that have a workspace in SMS. Everyone from the 3rd Infantry Division to the Directorate of Logistics at Fort Hood, to there's the Corps of Engineers, and there's even One college has an ROTC unit, and they track their GPAs and APFT scores. It doesn't cost them any more money. It doesn't cost the Army any more money. If they want to track trends over time, this is what the Army's tool is for to do that. So you see, MedCom folks have access to 4 private workspaces. Here's 3 of them: OTSG MedCom, the IDES Common Operating Picture, and the Soldier Medical Readiness Campaign Plan. We also have access to see the Army Campaign Plan. So I'll click on the dashboard here to see where does MedCom fit in the Army's campaign plan. You'll see underneath Campaign Objective 2.7 is ensure medical systems support the total force. So if you click on a dashboard in SMS, it lets you it drills down into from the dashboard view to the hierarchy view. And that's where we see those things that MedCom is responsible for: providing optimal health care for soldiers, families, retirees, having a responsive battlefield medical force, etc., etc. And then you see the normalized scores here on the left, because providing optimal health care for soldiers is not just one measure. That's a host of measures. And so if you can continue to drill down either here in this left-hand side or on the left-hand side. So when you click on a measure, it kind of takes you on a journey. It shows you where it's drilling down into. Because Campaign Objective for the Army 2.0 is part of the Assistant Secretary for Installations, Environment, and Energy. It's bringing us to the ASA IE&E's ACP structure. So here, now we can drill down further into seeing, how is MedCom tracking providing optimal health care for soldiers. Okay. So we want to go back to dashboards. And rather than look at the Assistant Secretary of the Army's dashboard, let's focus on something in MedCom. So I'm going to scroll back down and click on OTSG MedCom. Now you see there's 2 dashboards for MedCom. There's the Commander's Dashboard and the Army Medicine Strategy Map. So the Commander's Dashboard is what General Horho wants to look at, is a piece of the balanced scorecard. So in the future, the Chief of Staff will receive the full balanced scorecard briefing, and General Horho will only receive sort of these key measures that she finds key as to how the enterprise is operating, is performing. So we can look at this review and analysis, and each one of these measures: soldier medical readiness, family members and retirees at a healthy weight, self-reported health status, med stage cases, etc., etc. We see lots of times we see the percentage, but in some of these we see, for employee engagement, we see a 6.93, which is an index, which is a normalized score. So we can click on the trend arrow to see the trend over time about how we're performing in any one of these areas. So I can click on the button, and I'll see that the trend over time about how we're performing in executing the med stage cases within 35 days. So I'm going to go back to the dashboard. So you can click on any one of these measures. We can click on the outpatient visit satisfaction. So we see the normalized, we see the actual value, and we see the normalized score. That score is based on where the breakpoints are between red, amber, green. And because we're kind of halfway in the amber, that's why we get right about a 5 score, because the scores go from 0.00 to 10.0. We see the trend over time about how we're doing for patient satisfaction, and we're in a quarterly view, but we can switch it to a monthly view, and we can even go to January, because this is part of the automated feed from MODS. We have set up an automated feed from the Medical Operational Data System for several measures. And so we don't just see patient overall visit satisfaction for MedCom wide, and we can scroll back here to see a trend over time. What we want to do is we can switch it from the hierarchy view to the hierarchy executive view. And now I can see how we're doing in each region. I can open up a region, see how we're doing for patient satisfaction at Drum, Knox, Bragg, Meade, etc. You can click on the plus sign next to each one of these, and then you're going to see the raw value for the number of patients satisfied with their visit and the number of patients. Now, we really shouldn't look at January data yet, because January is not yet complete. So we'll go back to December. So it's that same view. So We can look at European, we can look at Northern, and we can click on those same trend arrows to see how is Fort Drum trending over time. See their percentage in Apple's question 20. Right? Now, what I haven't showed you is this far right side. We see it looks like a piece of paper with an arrow. I can click the Send Page To button, and I get this drop-down menu. The first choice is My Bookmarks. So if I want to come back to the patient overall visit satisfaction, I can save it as a bookmark, and that's that first screen that pops up when you log in. So I can click OK, and now it's one of my bookmarks. I can go to Bookmarks, and there it is. It's now my bottom bookmark. I'll go back to the hierarchy view, and you see in the hierarchy view there's a sub-menu. So we're currently in the executive view. But let's switch it to the metrics view. So what it's going to do, it's going to show me all the metrics subordinate to whatever I click on this left-hand side. And I can click Edit Report to show me 6 months, 7 months, or whatever time period I'm in. If I'm in a yearly time period, it'll show me 7 years worth of data. If I'm in a weekly time period, it'll show me 6 weeks of data. And you can decide what you want to see. Do I want to see how often it's measured? Do I want to see who the owner is? Do I want to show parents and show submetrics? Do I want to see the actual value and the green threshold, etc., etc.? Click Get Report. And now I have a laundry list of data, right? I have to do a lot of scrolling to see all these numbers. Because I see not only the percentage for outpatient visit satisfaction, but what the numerator and denominator are. So I know that in December, 15,000 people took the survey and 14,000 indicated either a 4 or a 5. So something like this might be handy to send page to Excel. So I click on Excel, and it takes a second to transfer over to Excel. And I want to click Open. And now I'm looking at the same chart in Excel. And it should bring across the percentages. I guess there's a slight bug right now. But that's part of what the Army has paid for. They have, what's in the POM for SMS is constant upgrades to the software. And MedCom is a sort of major player in using SMS. So when we suggest to the Army that we would like this change to take effect, it's very well heard within the Army Program Office that runs SMS. So you can also send page to briefing book. Now a briefing book sort of, rather than is what an administrator can build that assigns it to an organization instead. So right now if I click Add to briefing book, it would attach this to the OTSG MedCom level briefing book. I can also send it to the printer, Word, PowerPoint, or PDF. And some things like a dashboard or a strategy map, you can send to a JPEG image. I do want to stop for a second, just because I've been moving through the software for a while, to take a couple questions. So
There are a few questions that have come in over the chat. One is someone wants to know how they enter new bookmarks in.
Okay. So the easiest way to enter new bookmark is that Send Page To button. So you click on the Send Page To button, and whatever screen you're on, I'll choose My Bookmarks, and you can decide what you want to name it. So if I want to name it Aspire, I'll click OK, and now I'll go back to my bookmarks, and in the far, at the very bottom of my screen, my bottom bookmark is Aspire. And here's that same screen view that I want to come back to on a routine basis. And that's why you would build a bookmark. But you can also right-click and click New Bookmark. And here I can add in a new bookmark. So I can call this Aspire. And what I can add is the URL for the DCO recording. I don't know the URL offhand, but it would be that simple. Okay?
So, Donna Medic, let us know if that answered your question. And the next question comes from Major Surrey. She wants to know why SMS can't, if SMS could import all of the Apple's data, it would guarantee accuracy and eliminate individuals from having to do the work.
Absolutely. We first worked out a system interface agreement with mods to pull over certain numbers: the outpatient visit satisfaction, some medical readiness category data, the 68 whiskey accreditation, and I think there's one other. But now that that interface is in place and it's an automated feed, what we can do is expand that interface agreement so that we do reduce the manual upload problems. And because we have the data down to all MTFs, this tool is really built for the operating company model. If the OTSG MedCom level decides here's what we're going to track at every throughout the command, especially if the data comes from a centralized database, we can sort of build balanced scorecards or build dashboards for all our regions and MTFs. The Army Provider Level Satisfaction Survey is what APLS stands for. Okay. So
then another question about correcting data. So for example, in the Vice Chief Staff of the Army briefing slide, if numbers like the number of HR and AD providers is inaccurate, how do we correct the number?
Okay, that's a good question. I'm going to move from the OTSG MedCom section of SMS so I'm going to click on the blue circle in order to change organizations, and then it brings me back to the hierarchy of organizations. And I'm going to scroll down to the IDES Common Operating Picture. So I'm going to click on the IDESCOP. So I can click on this IDESCOP dashboard. And so I see these trends over time. Now, one of these measures is the NARSM production. So that's based on a data feed from the Veterans Tracking application where we count the number of NARSMs. But it's also a manual update of the number of full-time equivalents that are completing our narrative summaries. So in IDES. So I can click on this metric, and then it's going to, by default, when you click on a dashboard, it takes you into the hierarchy view. So I see here that our number is 18.32 in October. If I scroll down, I see that the total number of MEB providers in December was 104.81. The number of completed NARSM cases was just under 2,000. So it's very simple math. It shows you what the math is. And by default, the data used in calculations box is closed when you first log into the software. You just click on that anywhere on that line, and it'll open up that box. Same thing with actual and threshold values and historical performance. Any one of these boxes you can minimize. If you don't want to see the speedometer, if you don't want to see this historical performance chart, you can open and close them at any time. So the number of FTEs is currently being updated by the regions because we were told that an automated feed from Dimmer's Eye wasn't quite ready for prime time, so to speak. So that is a manual feed. So the only piece of the entire IDES structure that is a manual update is the number of FTEs at each one of the hospitals. There's about just over 7,600 data points that feed the IDES Common Operating Picture that feed about 40 some measures. So I can drill down into any one of these, like the Army average number of days for the med phase, and I can see how each region is performing and how each hospital is performing, and then even by compo at the hospital. So I can see at Fort Bragg how are we doing at executing the med phase over time for compo 1. And then in one of these trend charts, I can click on the little arrow and drag it back. So it looks like Fort Bragg started doing IDES in about April, or finishing their first IDES case in 2010. But, I mean, because of this, several of these things, we've started to kind of turn the corner for IDES. So a lot of the IDES service line folks are very pleased with some of these numbers. Like if you look at the average number of days for NARSM, if you look at the trend over time, that the Army's really showing sort of a good news story. Now we're not where we need to be yet, but if you look at this trend the last few months, and let's switch it to January to see of those that have completed in January so far, let's see how the number looks. So that's the thing, is every hospital, every region doesn't have to do all the same work. Sort of one entity can set up an automated feed for all, and everyone can benefit. And now that it's online, you can brief live from the software. You don't have to go into, building PowerPoint slides week after week, month after month, quarter after quarter. And it's not just for IDES, it's for many measures. So another thing I want to show here is if I click on the IDESCOP and go back to OTSG MedCom, you'll see at the bottom here, there's something called MedCom Data. Now if I click on the plus sign, we see that's sort of a repository for Oryx, HEDIS, Civilian Fill Time, MedCom Speaks, Apples, TRIS data, performance planning data, etc., etc. So I'll change to a quarterly view. And so here we can look at enrollment overall at MedCom. So how are we doing at achieving our enrollment? We can see how each region is doing in enrollment, and again, how each MTF is doing in enrollment. So here, how Fort Drum is at 94% of their enrollment based on their business plan target. We can do the same thing with their business plan value production. And so all this data we're trying to feed into certain areas. So medical readiness category data. We're just building this out this week. So I can see, at Fort Campbell, the number of soldiers who are medical readiness compo 1, in the active force. Right. Another thing, we can go to MedCom Speaks to see the employee engagement index. So I can see how we're doing in employee engagement. And this is that normalized score that we saw on the commander's dashboard. Now this one takes a little bit longer to load because there's over 27,000 data points that drive this score for employee engagement. So if I click on this button, it looks like it's just one thing. You see this score here. And like I said, this one takes a little bit longer to load our score of 7.42. And this is sort of talks about what MedCom Speaks is and which one of the questions comprise the index. And if I scroll down, I'll see each one of the questions. And you can drill down to MTF level, and it's not just MTFs, it's also for our major subordinate commands. So I click on the plus sign here, next to question 15, to drill down into public health command, to see how their public health command is performing on question 15. So we're in the middle of setting it up so that each one of the MTFs and each one of the major subordinate commands can see how they're doing at the employee engagement index, which is a compilation of all 15 questions. So you see here the actual values for each one of the questions, and on the far right you see the normalized score. And so because each question is weighted equally, that's how we arrive at our score of 7.42. But for any one of these questions, I can click on the plus sign to drill down into, so question 43 is, there's no significant organizational barriers to my ability to be successful in my job. The overall MedCom score is 52.71%, but I can click on the plus sign to see how each one of the regional medical commands and major subordinate commands are performing, and then again drill down into regional medical command to see how each one of the hospitals are performing. Now you see, as you maneuver through SMS, there's sometimes a red exclamation point on this left-hand side. That is not because there is a bug or error, as some people often think. That is just an indicator that while question 16 is green overall, it's letting you know that somewhere underneath here, there is a red metric. So while Northern Regional Medical Command is green, I click on the plus sign to see that some of the hospitals are red beneath it. Same thing with MedCom Headquarters. Well, MedCom Headquarters overall is green. Some of the subordinates are red. And you see if we click on some of these organizations they don't have any data. And for MedCom Speaks, if less than 10 people respond, they won't report how many responded favorably. Because for executive agency, it looks like only one person filled out the Employee Speak survey, and so they won't put the percentage of how many were positive, because we would probably know exactly who filled out that survey, and that would sort of lose the anonymity. But that number is included in the roll-up from MedCom headquarters. So back to maybe a couple questions.
So you might want to take this one. How did you get to the IDESCOP? Like just physically, how did you navigate to it?
Sure. So to get to the IDES Common Operating Picture, so when you first log into the tool, you want to click on this drop-down, the very top left-hand corner. We can go to Dashboards or maybe the Hierarchy view. So I'll choose the Dashboard view, and then it'll present you with this menu. And if you're already looking at an organization, you can click on that blue circle, and then you'll see this menu of organization nodes. It's the hierarchy of organizations in SMS. It's really the hierarchy of the Army. So the Army, underneath Army organizations, is that shared space. But everything MedCom is doing currently sits in a private workspace, including the IDES workspace. So you click on the plus sign next to User Workspace, and you will see the IDES Common Operating Picture. So I click on the IDES COP, and now I see the dashboards associated with the Common Operating Picture. So I can see a geographic map. So here are all the IDES sites. And if I want to, and again, this is based on their normalized score performance for December of 2012. If I have questions, I can click on, well, someone is not performing so well. So there's only one red on here, so that's the one I want to click on. Walter, well, that's a JTF cat med, so we'll skip them. We'll just click on Fort Bragg. So you click on Fort Bragg, and it takes you on that tour down from the IDES COP level to just Fort Bragg. And here I see that Colonel Stephen Brewster is responsible for Fort Bragg IDES. He's the MTF commander there. We see their trend over time for their normalized score. What we want to do is drill down into how they're performing in certain measures. So we can go look at their average number of days for the MEB phase. We can see their trend. Looks like it's kind of in the green range, and even looking good these last few months. I can click on the trend arrow to see that for a while they were in the amber range. You can drill down into any one of these measures. And you see on this left-hand side, it's, I'm sure, tough to see on Defense Connect Online, the DCO, but there's a little chain link symbol next to each one of these, because all the data for the IDES COP sits at the top level, sits at the IDES COP level. That way you can set up administrators at Fort Eustis, but all the data is then linked from the top level. And so these links are the data only has to be uploaded in one place or input in one place, and then the data is used wherever it's needed. So that patient satisfaction data is used in many forums. It's not just the commander's dashboard. It's not just MedCom's balanced scorecard. It's also the Army campaign plan. It's also the Army's contribution to the DoD performance measures. So it's used in many venues. And if we go back to it, you'll see that the comments that the responsible person, so Dr. Glinner, so while Apple sits here, we see the patient self-reported health, patient overall outpatient visit satisfaction, and self-reported mental health. We see that the comments that Dr. Glinner, who's listed as the owner, put in, let's go back to a quarterly view. So the last time we briefed the Surgeon General, it was the July to September quarter. So the comments that Dr. Glinner 12 days ago put in, where she talks about why we're performing the way we are overall, these same comments also show up on the Army campaign plan and everywhere else that data is needed. So now, rather than a data call from the G1 to MedCom about medical readiness, or from the Assistant Secretary of the Army for Manpower and Reserve Affairs about IDES measures, it's all linked within one software, one Army tool. There's no more data calls. It's just, well, you're linked to it, why don't you just log in? Okay.
So we're down here to Major Allergen's question about how is CMS different from SMS?
Okay. So how is CMS, the MedCom's command management system, different from SMS, the Army's strategic management system? Well, the Army purchased a enterprise-wide license of SMS in 2006. So every Army user can use SMS at any time. It just has to be CAC enabled. And one of the main differences is rather than just a host of measures where we can log in and see percents and dollars and time, it's built to normalize those values so that you can so senior leaders can see how we're performing in a high level organization. And it's also built so that sort of power to the people, so that we don't have to go to contractors to build a new metric for us. Like if I wanted to build a new Army provider level satisfaction survey metric, I can right click and go percent of times DCO wasn't working. And I can track this monthly, quarterly. I can click next. I can decide what type of measure it's going to be. Let's make it a standard color metric. Make it percentage, last value. I can say that my targets are 60 and 80. And Lucy Goodwin and I have built several sort of, we have user guides and things like that, and we offer training sessions to train folks how to build all this, how to left click and how to right click, and how to build your own dashboard, how to build your own metrics. So now I have percent of times DCO wasn't working, and because I'm an administrator, I can already update this metric, and I can put in a 98% of the time it wasn't working. And I now have a trend chart, I have a score, I have a speedometer. So I don't have to go to anyone to build things for me. So that's hopefully that explains kind of the difference between the two tools. So as far as I know there's a conversation for patient-centered medical home. We're building a lot of things in CMS down to the 4th level MEPers to track our PCMH, both for the soldier-centered medical homes and community-based medical homes. Well, the SMS tool is really just building things to the MTF level, because we do want to sort of focus on this strategic management. Like PCM continuity is something that links up to the Surgeon General scorecard and may or may not be part of our feed to the Army campaign plan. But it doesn't make sense that the Assistant Secretary be able to drill down to each patient-centered medical home. Okay. So how is the medical readiness data interfacing with MedPros? That's a question from Ms. Jackie Smith.
Yeah.
I believe. So right now the MedPros data is fed into MODS. And so because MODS is sort of the closest thing to a data warehouse in MedCom, so a lot of the numbers that SMS that we needed to drive, sort of the balanced scorecard and the commander's dashboard and SMS, already were part of MODS. We wanted to set up an interface with MODS. And so MedPros data is fed into MODS, and then MODS data is then fed into SMS as part of a host of other measures. Okay.
Similarly, is the MRC repository updating the MRC metric on the commander's dashboard?
Yes. Yeah. So if we let's go back to the commander's dashboard. So I want to change organizations rather than just look at them. Well, let me delete that goofy metric first. So I'm going to change organizations. I want to go back to the commander's dashboard. So I go back to OTSG MedCom, and here we see the draft balanced scorecard. I'll go to dashboards and the commander's dashboard. So you see the first two measures there are soldier medical readiness for Compo 1, and then a combination soldier medical readiness of the reserve components, Compos 2 and 3. So if we click on it, we see that the data is linked here from the Soldier Medical Readiness Campaign Plan. That's another one of the private workspaces in SMS. And so if I scroll down, I see what the source metric is. So I'll click on that source metric, and it's going to, again, take us on that journey. On that left-hand menu, you see we're going to go from OTSG MedCom to the Soldier Medical Readiness Campaign Plan, where we see the MRC data. If I click on the plus sign, we see all the raw data. So the number of soldiers for the MRC1, the number of Compo 1 soldiers for MRC2, with 3A, 3B, and 4. And so this feed is importing all these numbers. So if I scroll down on the right-hand side to data used in calculations, what it's doing is it's adding the number of Compo 1 soldiers for the MRC1 plus MRC2 and dividing that by the total number of Compo 1 soldiers. So you see here the total number of Compo 1 soldiers for July, August, and September. Then here you see the comment left by Mr. Randolph regarding Compo 1 readiness. We see the trend over time for Compo 2 works much the same. It's the same equation. It's just now we're looking at National Guard soldiers. Hopefully that answers your question, Ms. Smith. Major Suri asked the timeline for uploading the data from Apples. So the interface agreement with mods is set up so that every Monday they put out new data, and SMS Connect, which is really the kind of a middleware between SMS and a host database. I'm logging in now to show you. It's kind of active feeds. I'm logging into the MedCom account rather than my personal Connect account to see here's the medical readiness category data, and here's the system interface agreement. So it says partial success, and it was last run Monday, January 28th. And so every Monday it'll re-import the data. That's why we already have the patient satisfaction survey data for January. So it's not all of the January's data yet, but as of January 28th data. Okay. And so we will want to expand the numbers of data, the volume of data points, both the depth and breadth, to mods for HEDIS, ORIX. I know dental readiness is something else we want to focus on. All of the medical readiness category data, etc. So we're expanding that, but this initial interface was just to make sure that it works. So it's only 103 data points currently. Okay. Ms. Medic asked, how do you add a SQL query to get data, and will it autofill the data? So you can set up a SQL query, so you can query SMS to populate a metric within SMS. We have done that, like percent of, count the number of measures that are green in order to get a percentage metric. But not everyone has the SQL access in SMS, just because it's sort of a administrator level permission. Okay. Okay. Another question is, when applying for an SMS account, how do you determine the role of a user? It's really based on what your command, your part of the organization does. Well, we can set up sort of private workspaces for all users. Most users are given access to just MedCom, which gives you access to those 4 private workspaces, as well as the Army's shared space.
Great. One more? There's 2 more.
Sure. Okay. So is there a way to export SMS data as a PowerPoint or PDF? Yes, the Send Page To button, you can send it as a PDF. Just be aware, I believe it sends the hierarchy overview page onto 3 separate PDF pages, sometimes 4 if you have a lot of data and a lot of comments. So what you're seeing on the screen now was just the export I mean, I just hit send to PDF of the current screen we were on. Yeah. Okay. You can also send to PowerPoint. Sometimes it's best to send like a dashboard. Like here's the Soldier Medical Readiness campaign plan. We could send this to PDF. We also see an embedded dashboard. And so for those of you that have logged into the Army Medicine portal or the SharePoint site, you've seen embedded dashboards on that AMP page. So I can either have a link on an embedded dashboard, or like this strategy map or dashboard can be displayed on your website. It could be your Facebook page, it could be your external website. You can show how you're performing at your major level items, and that's what you can do with the embedded dashboard. But here, I'll just send it to PowerPoint to see what that looks like. The focus of the tool was to brief live from the software. So sometimes, like the export to PowerPoint, it isn't the best. And so this is something that a lot of folks have complained about to the Army. You can see it kind of put my strategy map off to the right. So often if I'm forced to put SMS into a PowerPoint presentation, I do a screenshot of what's on the screen, and then that's what I put into PowerPoint. Hopefully that answers your question. Yes. Can SMS access pull dimmer's eye data if you wanted to build a metric that needed that info? Absolutely. The tool is built to be as flexible as possible so that anybody in the Army can use it. It's that connect tool that I started to log into to show you, different ways of data sources. Here we have mods, but we can have dimmer's eye. We can have as many data sources, whether it's Excel or an online data source to import data into SMS. I mean, obviously, it takes more than 60 minutes to walk through all those sort of means of getting data into this software tool.
And then Major Suri asked to clarify her question, she was asking when will she no longer have to upload her Apple's metrics into the database?
Okay. Major Suri, I have no idea what Apple's data you currently update. If it's more than just question 20, then we haven't automated that feed. If it's just question 20, then you don't have to update it anymore. What we want to do is set it up so that you can just comment on performance instead.
Looks like she's responding. Let's give her a second.
Okay. Yeah, more than question 20. But if we drill down into, let's say, the balanced scorecard for, I'm just going to pick on an MTF here. Let's go to Fort Eustis. So here they have their balanced scorecard. Let's look at patient, customer, stakeholder. Yeah, so provider level satisfaction question 20. So it looks like they've been updating this. They have a couple updaters listed. So they put in their 93.23%, but they don't have to do that. What I can do here is just right click and grab that data from elsewhere in the software. Because we have an automated data feed for that, Fort Eustis or any of the other MTFs don't have to update this data on their own. This is sort of the headquarters working for you kind of thing. So I'll drill down into MedCom Data. I'll go grab underneath Apples and patient overall visit satisfaction. I'll go to Northern, and what hospital did I choose?
Eustis.
Eustis, okay. So I just have to find Eustis, click on that, and do I want to grab the description, the notes, the owners? Yes, I want to have all that information carry over. And now on Fort Eustis's balanced scorecard, we see overall visit satisfaction and percent patient satisfaction for McDonald ACH. So they don't have to update this data anymore. It'll take a minute or two, but then you'll see on the far left this will turn amber. Whatever you see here on the right. So I don't want to edit a hospital's balanced scorecard without their permission. They're still sort of deciding on what the operating company model measures will be. But in the meantime, we're trying to sort of gather all the measures that could be part of that operating company model. So if there's other Apple's questions that you want to be part of what you track, we can set up an automated feed for that.
Because the feed only currently updates question 20, right?
Yes, that is correct. Because question 20 is all. The reason why we focused on that was because it's not just MedCom. That's linked to the Army campaign plan. It's linked to the DoD performance measures. The Surgeon General has to talk about how we're performing in overall visit satisfaction in many venues. And so because it's such high visibility, that's why we focused on that one at first.
And Jackie Smith has a question. So can the medical readiness information be grabbed for each MTF and region for the National Guard and Reserve?
No, that's something that we're currently working through. So medical readiness data for the Guard is tied to a state. And states don't neatly tie into MTFs or regions. Deciding which MTF gets the Texas number is not something that I want to decide. So we're building the structure so that you'll be able to see medical readiness category data by state for the National Guard and by sort of major subordinate command for the reserves. But again, it's not easy to associate those either the National Guard or the Reserve medical readiness data within MTF and henceforth a region.
Those are the questions that have come in on the chat.
Okay. I do want to point out, I'll go back to my bookmarks and show a couple of the resources you can go to. So we have a MedCom site about SMS on MillSuite. So you have to log into MillSuite. You'll see it's going to prompt me for my CAC card. And so here on this site, you can see that I'm listed as the owner, but Miss Lucy Goodwin is also an owner. And right here, this is what an example of an embedded dashboard. It's pulling the most recent data for the Army Medicine Strategy Map. So on an external website on MillSuite, you can see this data. Now these embedded dashboards were actually requested by the Army CIG-6 so that they could put on their external websites how they're performing at keeping data, systems and databases up to snuff. So they have red, amber, green for how they're performing at keeping up, the databases that they're responsible for, the websites that they're responsible for. So you cannot drill down into one of these. So the difference between embedded dashboard and being live in SMS is I can't click on one of these bubbles and then see what's underneath here. What's driving this red, amber, green? What's the score? I can't click on a trend arrow, etc. But underneath here, we see documents. So basic user training, administrator training, some guidance about the Army Medicine Balanced Scorecard, notes from our quarterly feedback session. Because MedCom is such a big player in the Army's use of SMS, we try to compile, quarterly, what are suggestions for the Army to change SMS. Because what's in the POM for SMS is changes. But who knows, with the fiscal uncertainty, there may not be any software changes. But even if all the money for SMS turns off, we can still use it as you saw me using it today. It just won't improve at all. What's in the POM is additional money, I think, out to FY18. So if you have any questions, you can go here to basic user training, and it's everything from sort of guiding you through those 3 axes to requesting an account to more advanced stuff underneath administrator training, like building your own reports. Like all SMS users, even read-only users, can build reports and bookmark their reports or save their reports tied to their profile. So I'll go back here. You can go to the AMP page, the Army Medicine portal. It's one of my bookmarks, and then you'll see a couple embedded dashboards on there. Yeah, I mean the percent of users who are from MedCom, and it's about 25% of the Army. So it's just something my boss wanted me to start tracking. So it's a query that we run. So I know the total number of users in SMS is only about, in December, it's just under 13,500. MedCom had 3,400 users. Most other organizations that use SMS, it's really just administrator and senior leaders. MedCom is really trying to make power to the people, like have as many people use SMS as possible. Are there any other questions? Anything else I can kind of give you a tour of, show off?
John, I think we've covered most of the questions from the pre-course survey. I know there was one specific to Apple, so I think we've talked about that. And if anyone else has any specific questions to Apple's data and SMS, you're welcome to email me or Mr. Ritchie, and we can also talk about it further in the Q&A session next week. We've talked about how the data are entered. That was another question that came in the pre-course survey. We've answered most of the other questions that have come in from the pre-course survey in the context of the briefing, but we want you to know that we do certainly pay attention to the questions that are submitted in the pre-course survey and want to make sure we can address this either here or in the follow-up. Sometimes your questions are really in-depth and we need to kind of go to a more concentrated group of folks in the Q&A. And for this particular session on SMS, we're going to have the Q&A next Wednesday, so we can follow up with any additional questions.
Okay, so some of the questions we got from the pre-course survey were, how can SMS be used to enhance department or clinic management? Now, I as sort of a OTSG MedCom level guy, someone that used to work in the Sec Army's office for many years, I always want to try to build things from the top level down. But if there's something that you want to track at your clinic, in your department, and you want to track trends over time, and you're tired of building them in Excel, making pretty charts in Excel and pasting those charts in Excel and writing your comments on PowerPoint, if you want to start just tracking it in a tool, the Army's approved tool for tracking trends over time, you have the ability to do that. We'll just set up your appropriate permissions, and even assist you with some training on how to do what it is you want to do. That's sort of the role of strategy management and Lucy Goodwin and I. So you can build all sorts of charts. There's chart writer. If I go to reports, I can build a new report that shows me all the owners and updaters. These are sort of canned reports. They can show me all the red metrics report, a report that shows everything that's missing values. I can build my own reports and my own charts, and all SMS users have the ability to do this. Now, you may only be able to do a report writer or chart writer on that which you have access to see. And again, all MedCom users have access to just those 4 private workspaces. So why the balanced scorecard is not being utilized, that's one of the pre-course survey questions. I believe General Horo plans to use the balanced scorecard in the future. The SMS was sort of pulled in to MedCom during the previous Surgeon General, and that's when we automated the balanced scorecard. but we've been told that General Horo does want the balanced scorecard to be used for not just the tier 1, but as part of that operating company model. So we'll be able to track those down to MTF level for all of the measures on the balanced scorecard. That's sort of the effort behind what you saw on the commander's dashboard. And someone even suggested sort of configuration change to SMS so that you can change owners and updaters all at once rather than in sort of use Spider Connect to do that rather than one at a time on each measure. But if you go to the Administrator tab and I go to Owners and Updaters, I can sort of, it's like checkboxes. I can decide that I want Sarah B. Ryan to be responsible for these measures, and I can check all or uncheck all, or let's build an example here. So let's go to let's drill down to OTSG MedCom, go to MedCom Data, and we'll go to Apples. So right now, Dr. Glinner, let's type in her name, Dr. Melissa Glinner is who pops up. So right now, she's listed as the owner for just one checkbox. But let's say Dr. Glinner goes away, or first of all, I can check all and then save, and then her name would show up as the owner next to all self-reported health measures and patient satisfaction measures that come from the Apple survey. But if Dr. Glinner PCSs, and let's say that I take over her job, not saying I'm going to do that, let's pick somebody else. Let's pick Lieutenant General Horoho takes over Dr. Glinner's job. I can just do check all and click save, and then General Horoho's name will be listed as the owner for all of these measures. So that's sort of a faster way rather than to do it one at a time, an owner and updater for each measure. So it's a little different. If I click on updater, we see there's both columns. Do I want this person to be able to update the data and the thresholds, or just the threshold, or just the data? Okay. So hopefully that answers that question. Okay, how do you develop an action plan? So action plans are, again, sort of like a Gantt chart. The Army's always done a really good job of coming up with tasks and task management. But what SMS is really for is tracking performance management. What are we trying to achieve? Like HEDIS measures are process measures. What are we doing to try to affect diabetes or a breast cancer? That's what the HEDIS measures are for. But the performance measure would be prevalence of breast cancer or prevalence of diabetes amongst our population. So if we want to then build an action plan about, let's go down to HEDIS. So OTSG MedCom, MedCom Data, and HEDIS. So let's say we were tracking underneath HEDIS compliance, like we have our diabetes annual A1C test. That's how how many people get tested, but that's not really the performance measure. We do these tests in order to hope that we can manage the number of people that have diabetes. So what we might want to do is build an action plan to, I'm going to right click and build a new action plan, and we're going to call it the diabetes action plan. And so, when does it start? It automatically entered today's date, but I can backdate it if I so desire. January 1st, right? And I can say that it's due by May 30th. It's not over yet, so I'm not going to enter the completion date. I'm going to say I'm going to take $5,500, and I spent $200 so far. It's 7% or 6% complete, and we want to raise diabetes awareness. So finished. And so that's the action plan, and then I can build milestones in that action plan, just like sort of like MS Project. So I see the overall action plan by June 1st of 2013. We will want to institute our diabetes awareness plan. And we can have milestones and actions along there. Like, the due date could be February 21st for, let's call it, approve, or like DCOM, approve radio ad, right? Click finished. And so the the communications folks have to approve, if we look at our Gantt chart, by this point they have to approve our radio ad. Otherwise, we're not going to meet our timeline of releasing our, awareness campaign for diabetes on time. So that's sort of how action plans work. And the action plans were built as part of SMS, mostly because of SMS feedback, because the balanced scorecard was really based on looking at performance measures and then initiatives to affect change, right? So we want to build these action plans to track how well our initiatives are doing. And so we can look at the Gantt chart. We can look at sort of the overview. So it's 6% complete. And so if you have many actions as part of your action plan, it'll add up all the the total budget, how much you've expended, the percent complete, and the elapsed time, right? It's because it knows that it's the end of January, so it's 19.4% complete so far. So it sort of tracks all this for you. So I can assign someone as responsible for this. I don't think you have. Yeah, let's just click order. So I can make the Surgeon General responsible for this diabetes action plan. Or I can make all right, I was looking for General Gonzalez, but she may not be listed as an owner for this piece. So that's sort of how action plans work. So we've looked at my bookmarks, we've looked at dashboards, briefing books. So if I go to briefing books for OTSG MedCom, you can see there's only one briefing book in here, and it's the Commander's Dashboard briefing book. It's sort of, for those that aren't familiar with maneuvering through SMS, it'll guide you through exactly what is briefed to, and this is what briefed to General Lyon, and what's planned to be briefed to the Surgeon General. So each one of these measures, how we're doing enterprise-wide, but then you can click on self-reported health to drill down in to see, how each of the regions. So I click on it from the briefing book. It's really not static. It just sort of guides you to something, but you can click on it to then drill down into, how each region is doing with patient self-reported health, how each MTF is doing with this measure. Okay. So bookmarks, dashboards, briefing books, the hierarchy view. You saw that there's several sub-menus within the hierarchy view. Everything from executive view to the default is the overview. We've looked at the metrics view. I can also look at comments, analysis, actions, which are if there's an action plan or Gantt chart attached to that, any related items. So we can go to related items. Let's go back up to the Commander's dashboard to show on public health command, family members and retirees at healthy weight. If I scroll down here, you'll see related items. That by default this box is closed up. You click on it, you see here's all these related items. So it's their campaign plan, it's their their memo. And so if I switch to the related items, it's going to show me all the related items here. So it shows me here's the metric, here's the description, who's responsible for it. Then click on any one of these. And it's going to drill me down into public health command because they're the ones that are responsible for this. In order to show me, the information paper about, what they're doing for family member retiree campaign plan. So again, this tool was built by the Army so that each organization could break down and measure what it is they're responsible for, and then feed that information up. And so MedCom can do much the same. So Public Health Command breaks down and measure what it is they're responsible for. In this case, tracking body mass index, and then it feeds up into the overall MedCom. They don't have to send PowerPoints or send Excel sheets. They update the data in SMS. They put their comments in SMS, and it's immediately available. Okay.
Can you pull the slides back up?
Yes.
As a wrap-up for today's briefing, we have a couple of requests. First, please take the post-course survey. It's listed here in the slides. I also just posted the URL in the chat. It will help us know how we're doing. It allows you to suggest topics for future courses, and it also allows you to submit some questions that we can begin to ponder before next week's follow-up. Next week's follow-up. So the follow-up Q&A with Mr. Ritchie will be on 6th February, next Wednesday, at 1300 Eastern Standard Time, and we'll use the same DCO room. So if you are a new account user from between then and now, or you spend some time looking through SMS and have additional questions, we welcome you to come back and ask some follow-on questions next Wednesday at 1 o'clock. Third, then will be an introduction to access, and that will present the third next available appointment metrics and the standardized templates that come out of the TRICARE division. Mr. Joe Kozak will be the presenter, and we know that's a hot topic and hope you can join us for that. We'll use this Aspire DCO room for that as well. So that's back on Thursday, 7 February at 1300 Eastern Time. And I have not yet sent that information, but I will. Fourth, it's not on the slide, but it's very exciting. We're getting a SharePoint site. So that's part of the reason the delay in the invitation is I would prefer to send it out from our new and improved SharePoint site. So look for that announcement to come. We're very excited about that development. Finally, we've recorded this course, and you'll be able to